This is exactly what the difference between maintenance medication and these drugs are. And this is why they're maintenance, and that's why you're not addicted to the maintenance medication. When you do a straight agonist, except for methadone because it's long half-life, and even that can be abused, when you're what separates, let's say, heroin from Suboxone is heroin, you cannot cheat addiction and outsmart it at the psychological level. Remember before we talked about if society was cool with addiction, you could do it. Keith Richards, he's got $100 million. He can be an addict and function pretty damn good because his environment supports his addiction, even though it's still killing him, but he can maintain it for a long time. What does heroin do? It completely destroys your receptors, pain receptors. You need more and more and more and more. You spent your whole life trying to get this substance. Society is not fit where you can walk in and get a clean needle and use it. It's expensive, it's illegal, but at the physiological level, you get a euphoria, which you're no longer yourself. You disconnect the frontal cortex from the midbrain. You will constantly need it more and more and more and more, and eventually you overdose, okay? That's addiction. Now, that's why you can't maintain a heroin addiction. And can somebody, remember the other day, I think we were talking, I'm like, sure. In theory, there could be 1 out of a million people like Keith Richards that can maintain a 50-year heroin addiction, but he has so much money and his lifestyle, he doesn't have to go and solve rocket science equations. He's a brilliant musician, right? So, and even that most people can't do. They lose everything. We see people dying that are rock stars. For some reason, he was smart enough or had enough resources to maintain it, but that's 1 in a million. This stuff, you constantly need more. You're getting high and you can't think. Your frontal cortex disconnects from your midbrain, and eventually it will catch up with you. Suboxone, you need a certain dose. You know exactly what's in it. It lets the frontal cortex heal and the midbrain connections heal because of time. It lets your pain receptors heal, and you take it like any other medication. That's where the difference is. It's in the physiology, and it's in the pharmacokinetics and in the pharmacodynamics that allows the behavioral patterns to change.